Acute flaccid paralysis, in children. What is acute flaccid paralysis? Acute flaccid paralysis is a clinical syndrome characterized by rapid onset of muscle weakness, reduced tone, and diminished reflexes, primarily affecting children under 15. It is not a single disease, but a set of symptoms often caused by viral infections, like poliovirus or enterovirus, or autoimmune disorders such as Guillain-Barré syndrome. What are causes of acute flaccid paralysis? It has following three common causes. Infectious causes are poliovirus, non-polio enteroviruses, and Campylobacter infections. Autoimmune or neurological causes are Guillain-Barré syndrome (MBBS) is the leading cause globally. Other causes include transverse myelitis, traumatic neuritis, and acute flaccid myelitis. Why has WHO started AFP surveillance? The Acute Flaccid Paralysis Surveillance System was created in 1988 by the World Health Organization, WHO, and its international partners. It was built for one specific disease: poliomyelitis, polio. When the World Health Assembly resolved to globally eradicate polio in 1988, health authorities faced a major problem. They could not rely on doctors for simply reporting polio cases. The system was designed around the broader syndrome of AFP for the following reasons. How is AFP surveillance done? Because poliovirus looks identical to many other conditions at its onset, public health networks use a broad syndromic definition to capture every case of sudden weakness, which allows them to track several other severe conditions simultaneously. Identifying non-polio enteroviruses. AFP systems actively test stool samples to find non-polio enteroviruses. These viruses can cause acute flaccid myelitis, a serious polio-like neurological condition that causes permanent limb weakness in children. Monitoring neurological and autoimmune trends. By casting a wide net, AFP surveillance tracks the baseline incidence and sudden spikes of other major paralytic disorders. Guillain-Barré syndrome. It is the most frequent cause of reported AFP worldwide. Transverse myelitis. It is the acute inflammation of the spinal cord. Traumatic neuritis. It is the nerve damage caused by poorly administered injections or physical trauma. What happens in the laboratory? Once the stool reaches a reference lab, it undergoes multi-step virological testing. Cell culture isolation. The sample is inoculated into specific cell lines to see if an enterovirus grows. Intratypic differentiation. If a virus is isolated, molecular tests, like PCR, determine if it is a harmless background enterovirus or a poliovirus. Genomic sequencing. If it is a poliovirus, the lab maps its exact genetic code. This lets scientists trace its origin back to a specific geographical area, or track whether it is a wild strain or a vaccine-derived mutation.